Hello everyone, my name is Hospicio. I'm here to present to you guys regarding population level health education intervention. The two health-related problems that I found to be pertinent in the underserved community is obesity and hypertension. According to Harrington, widespread obesity poses a serious challenge to health outcomes in the developed world. Obesity is strongly associated with a range of comorbidities such as poor mobility, osteoarthritis, sexual dysfunction, depression, and there are also increased risk for stroke, diabetes, heart disease, and certain cancers. There's about 85 million Americans are affected with high blood pressure, and it's also a silent killer. Backward in significance. During my windshield survey and few visits in the clinic, I found that the obesity in San Fernando Valley, including Pacoima in the list, there are 19.8% of children in grades 5, 7, and 9 are obese, and there are about 21.1% of adults are obese. And also, there are 42% of Latino adults who are obese compared with 32.6% of whites, and this may be related to lack of access to affordable healthy food, and other barriers. Also, there are 23.9% of adults who are diagnosed with hypertension in San Fernando Valley, includes what's in Pacoima, and there are around 28.4% of adults who are diagnosed with high cholesterol. And heart disease is the number one killer for all Americans, and stroke is the fifth leading cause of death. Um, Healthy People 2020 objectives for obesity. According to Healthy People 2020, the goal is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievements and maintenance of healthy body weight. Objectives: increase the proportion of physician office visits that include counseling or education related to nutrition or weight. Increase the proportion of adults, children, and adolescents who are at healthy weight, and reduce proportions of individuals who are considered obese. Our interventions, according to Office of Disease Prevention and Healthy Promotion, the 2015 to 2020 dietary guidelines is designed to help Americans eat a healthier diet, and the guidelines outline how people can improve their overall eating patterns. And according to Healthy People 2020, the goal is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke. Objectives: reduce the proportions of people in the population with hypertension, increase the proportion of adults who have had their blood cholesterol checked within 5 years. Our interventions: the community health workers will screen for high blood pressure, cholesterol, and behavioral risk factors, and deliver individual or group education in CVD risk factors, provide adherence support for medications, offer self-management support for health behaviors changes such as increased physical activity, and promote smoking cessation. Our needs assessment. After the observation of the community, there are factors that may influence behavior, lifestyle, and responses to the environment related to poor nutrition and obesity. There are predisposing factors such as there's a high rate of individuals in the community that has no school or some high school educational experience. Moreover, one of the staff members in the public health said there's an inadequate access to health services that may help the community to learn about the importance of nutrition. So I spoke one of the chairperson of Pacoima Council and said that since obesity is one of the significant factors that predisposes the individual in certain diseases, they try their best to communicate this issue to the government, and they attempt to provide resources to the community. Moreover, when I talked to Anna, one of the nurse at the clinic, said that most of her patients have lack of knowledge about hypertension. They don't get treatment until symptom occurs, such as headache, dizziness, or vertigo. There might be inadequate resources for the poor individuals in the community in regards of accessing medical treatments and diagnostic tools such as blood pressure monitoring and monitoring blood levels such as cholesterol or lipids. our theoretical framework and its assessment. So we're using Precede Proceed model, and it's a comprehensive structure for assessing health needs, for designing, implementing, evaluating health promotion and other public health programs to meet those needs. For Proceed, we provide the structure of planning a targeted and focused public health program, and for Proceed provides a structure for implementing and evaluating the public health program. For this project, the Proceed component of the framework helped me target a focus assessment by including the defining ultimate outcome in regards of what the community needs by using a windshield survey and face-to-face interviews. And I spoke to public health nurses, and we used windshield survey and spoke on the council. And we identified the issue. We found that there's increased poverty level, not affordable for the community to buy healthy food, not enough resources for affordable gym or workout sites, lack of knowledge about nutrition, lack of motivation to work out, increased consumption of alcohol and tobacco, and cultural food contribution to hypertension and obesity. Moreover, examining the factors that influence behavior, lifestyle, and response to environment. There are high rate of individuals in the community with no high school or some high school education experience, inadequate resources for the poor individuals in regards of accessing medical treatments and diagnostic tools. So there are potential barriers for implementing health educational classes, such as language barriers, lack of people not interested with the topic, lack of motivation by the individuals to learn, and also for administrative approval for the educational classes to be implemented. Moreover, for Proceed, I distributed flyers. I created brochures for hypertension and obesity. I created posters too so they could see the different about obesity and hypertension. And I used one of my colleague as my Spanish translator, just in case I need someone who really don't understand what I'm teaching them. And also, it's about this proceed is about development of short-term goals and long-term goals. Issues, education and process. There are certain barriers that may be included, such as increased poverty, lack of knowledge about nutrition, lack of motivation to work out, increased consumption of tobacco, low literacy related to low education levels. Specific behaviors that may strengthen to reduce the effect of problems, such as facilitating learning through increase of educational classes to the underserved communities, address environmental factors or individual factors such as disability. The individuals need appropriate education that is easily understandable in regards to the problems, and these individuals need to be motivated and ready to learn, so effective learning can occur. According to CDC, the Public Health Accreditation Board defines community health assessment as a systemic examination of the health status indicators for a given population that is used to identify key problems and assets in the community with an ultimate goal to develop strategies to address the community's health needs and identified issues. Um, there are resources available in the community, such as neighborhood council that promotes public health participation in government to make government more responsive to local needs. Also, there are homeless shelters, public health clinics, and food drives available for the people who are in need. Also, there are community health fairs in the community with free dental vision, diabetes, and high blood pressure screenings. And at the public health clinic, individuals require to complete a form, and the services include immunizations, screening, treatments of tuberculosis, and other sexually transmitted disease. Interventions. I developed two health educational classes at homeless shelter and the clinic. I created brochures and posters in regards to my teaching classes. I posted flyers prior to my teaching classes. Within the brochures, I transferred parts of the material. I translated parts of the materials to Spanish, and I also used one of my coworkers to help me out as a translator. Our objectives are to increase the proportion of adults, children, and adolescents who are at a healthy rate and reduce proportion of individuals who are considered obese, reduce the proportion of people in the population with hypertension, increase the proportion of physician office visits that include counseling or education related to nutrition or weight, increase individuals to get their high blood pressure, cholesterol checked too. In my presentation, I made sure that they understand the preventative measures to take prevent obesity, such as unhealthy foods, sugary beverages, increasing physical activity, improving sleep, and reduce stress. Moreover, I made sure that they understand the disease process for individuals who are affected with hypertension. I provide posters, handouts regarding the nutrition or hypertension. During my lecture, I asked questions related to the topic, such as what do they know about hypertension and obesity, risk factors, and what have they done before that could help them promote wellness, including motivation and lifestyle habits. Budget. In my presentation, just spend minimum amount of money to print my materials, including flyers, posters, and handouts. Hypertension and obesity is prevalent in the community. May need fundraisers and support from the community and government. Nurses or volunteers who will do educational class should have appropriate trainings and skills to. If I was getting paid for doing this, I will need an appropriate place to conduct my classes. If I need an appropriate community floor to conduct educational classes, it may cost up to $200 per hour to use the room. My per hour rate can range from $40 to $50 an hour, and materials can cost up to $500 or more, depends on the materials needed. Project evaluation outcome. Our goal is to promote health and reduce chronic disease through increased awareness related to nutrition and chronic disease such as obesity, and promote education to enhance the community's understanding about health promotion. The short-term objectives developed in the obesity include by the end of the class, more than 50% of the participants will be able to verbalize understanding of need of lifestyle, and they will be able to verbalize the importance of nutrition and ways to control weight. And they will be able to identify inappropriate behaviors and consequences associated with overeating or weight gain, and to identify resources in regards of optimizing health nutrition. And my short-term objectives that I developed in regards of hypertension include more than 50% of participants will be able to identify activities that will help reduce blood pressure and will be able to express their knowledge and understand about the disease process, and will be able to identify correlation between hypertension and obesity, and will be able to identify acceptable blood pressure parameters. Long-term objectives, since there is a need in increased education and counseling in the underserved population. The objective that I found to be consistent is to increase the proportion of physician office visits that include counseling or education related to nutrition or weight gain for this underserved population, since they also lack knowledge about management of hypertension. The long-term objective that is applicable is increase overall cardiovascular health within the community by providing enough resources and education about treatment, management, and lifestyle changes related to this condition. Results and conclusion. One of the positive aspects of planning and implementing my intervention was that I was able to implement educational materials with extreme support from the faculties and colleagues. The second positive aspect that I was able to assess and implement the needs of the underserved neighborhood in regards of nutrition and chronic disease. Although that most of the underserved Hispanics, I was still able to provide effective teaching materials that were easy to understand and with the use of an interpreter as needed. Few participants were able to come and listen to my educational classes despite my distribution of flyers around. There were around 8 to 12 participants on each at the homes and the clinic. One of the challenges that I was able to overcome is setting up the time and place to teach my educational classes. I had to wait approval to make sure that it's okay for me to teach those classes. The other challenge I was able to overcome was making sure that I had enough supplies and materials for the participants who will be able to come for my educational classes. And I had to post flyers prior to making my educational class, but it costs money, including printing and materials and posters. Future recommendation, maybe need help implement educational class, a group of nurses or students. Needs to increase my participation with the help of the organization or certain people in the community, leaders, teachers, etc. May need fundraising to use as a budget and materials, community classrooms, and events, and creating events. And this is my references, and this concludes my presentation. Thank you.